COVID-19, also known as just the coronavirus, has taken the world by storm. There are more than 2 million cases worldwide, and in India, there are more than 12,000 cases of the coronavirus. India, as the second most populous nation, has over 1.3 billion people. So you might ask, why is only 12,000 people getting sick that big of a deal? Well, COVID-19 isn't your typical virus. It's extremely contagious, and some people have it for several days before they even get symptoms and know that they're sick. What is the amount of time it takes for a person who is sick to show symptoms of the illness called? A. A vaccine, B. The incubation period, or C. The prognosis? If you picked B, the incubation period, your answer is right. The incubation period is the time between when you first get a disease to when you start showing symptoms. When you don't know that you're sick because you don't show symptoms, it's really easy to pass on the virus to someone else. The virus can be passed even unintentionally when you touch an infected person or something else that they have touched. Although most people who get the coronavirus are fine, the more people who get it, the more people there are who are severely affected and need to be hospitalized. However, a hospital can only take in so many people. At a certain point, it cannot take any more patients, and those people who cannot access a hospital could die. Even someone who doesn't have the virus, but who needs to go to the hospital because of a car accident or a heart attack, will not be able to go. They could be saved, but there simply would not be space for them. This is why the Prime Minister of India, Narendra Modi, announced a countrywide lockdown. Indians aren't allowed to leave their homes except for special cases, such as if they work as a doctor or need to get groceries. Since most people are staying at home, this slows down the spread of the virus. Less people are outside and interacting with each other, so less people get sick, and hospitals don't have to take in too many patients. The government has also released an app called Arogya Setu. It gives people important information about the coronavirus, and it keeps track of if you could have possibly encountered someone who was infected with the virus, and what to do if you are at risk. Elderly people and people with respiratory diseases like asthma are the most at risk for getting extremely sick because of the coronavirus. However, even people who aren't at risk can get the virus since it's very contagious and can pass it on to someone who could need to be hospitalized. So, regardless of whether you are at risk or not, everyone who can self-isolate should be doing so to protect people who can't and are at risk. Different people in India have reacted differently to the announcement of COVID-19. Some people are scared and misinformed, and they think that doctors have the virus. Doctors and other healthcare workers in India face harassment and threats of eviction, as landlords are afraid that they'll bring the coronavirus into their homes. However, there have been some good things to come from this. For example, the skies of the major cities in India are much clearer and bluer, and we can especially see that with the capital city of India. What is the capital of India? Is it A. Mumbai, B. Chennai, or C. New Delhi? If you chose C. New Delhi, you're right. New Delhi is the capital of India. And it has seen less pollution in the past few weeks and clearer and bluer skies as a result of less cars on the highways and less factories pumping out smoke into the sky. Additionally, There are many Indians who do recognize the sacrifice the healthcare workers make by helping coronavirus patients. On March 22nd, at exactly 5 p.m., hundreds of thousands of Indians went to their balconies and cheered for doctors, nurses, and other healthcare professionals. Later, in April, they lit 9 diyas at 9 p.m. for a period of 9 minutes to stand in solidarity to support the doctors. The number 9 is significant because it symbolizes the 9 Navagrahas. Some people, like actress Shikha Malhotra, are volunteering as healthcare workers to help treat coronavirus patients. Shikha Malhotra works as an actress, but during this pandemic, she is now working as a volunteer nurse in the coronavirus isolation ward. During times like this, it's important to remember that we're actually stronger together when we are physically separated. And we can support healthcare workers and those who have to go to work every day by staying indoors as much as possible and washing our hands thoroughly. So, while you can't shake someone's hand, you can give them a friendly namaste.